I want to let you know today that there's an increasingly desperate caravan of people who have decided they simply cannot stay in their home countries anymore. Economic conditions and the sort of realities on the ground are pushing them across the border once and for all from the United States into Canada, where they can hopefully find cheaper healthcare and cheaper medications than in the United States. There was a story some months ago I did about a daily caravan of Americans that crosses the southern border into Mexico for inexpensive but good quality dentistry in Mexico. And I think also it was optometry in addition to dentistry. And there's a new report this week in Newsweek about a so called caravan. And I'm using the term sort of satirically. People, Americans who are crossing into Canada looking for more affordable health care for type 1 diabetes, because the same drugs that are used to treat diabetes in the United States are used in Canada, and they're much cheaper in Canada. Insulin can be purchased in Canada for about 10% of what it costs in the United States. And as some of you know, since the mid 90s, the price of insulin has increased more than 1,100%, according to data from Truven Health Analytics. But as you also probably know, wages have not increased 1,100% since the mid 90s. And this is, of course, in addition to what most people are paying kind of in total for their health care, which is health insurance premiums and copays and uncovered medical expenses, et cetera, et cetera. Now, the FDA is officially taking the position that it is risky to travel outside the United States for insulin because the safety of the insulin might be compromised. The effectiveness of foreign insulin might not be as high. And of course, that could apply to some countries, but in Canada, it's fine. And this is just a truly horrible reality and an optional problem of the system that we have, right? The profit motive and the political impasse has fixed this issue, and it prevents us from actually dealing with it. And it's merely a decision we have to make. I mean, we know exactly how this can be dealt with. These are relatively simple math problems, actuarial problems, and mostly questions of political will. And I guess this is a good opportunity. I mean, while we're at it, I should dispel the notion that healthcare around the world is terrible and unreliable and dangerous. It's not exactly what the FDA is saying when they say you should gotta be really careful if you go anywhere else for insulin. Obviously, there are many places in the world where I would try to avoid having to get healthcare services if traveling or whatever the case may be. But there are so many countries, even countries considered so-called third world or developing countries, often have very good health coverage at very, very reasonable rates. Belize is an example. Belize has plenty of problems. The national income is about 8,000 PPP dollars, purchasing power parity dollars. So we don't even have to get to what that means. Just think about 8,000 US dollars is the sort of national income per person. It's not a rich country, but care is very good. And many Americans retire in Belize partially because they can get good, cheap health care. Argentina, my home country, riddled with problems. I mean, massive economic problems. But at private hospitals and private clinics where you would be paying for care as a visiting American, it is extraordinarily cheap by our standards, and you still get good care. Some of the public hospitals in Argentina, particularly outside of the capital city, not the best. But for what we're used to paying, going to private hospitals in Argentina would be very accessible and very good. Even in Mexico, Mexico is of interest more and more for Americans to retire to and for medical tourism. And a lot of websites now are solely dedicated to how can you legally get resident status in Mexico. It's, of course, very stratified between regions in Mexico in terms of what is available, but really excellent hospitals and care in many parts of the country, including Mexico City. So in any case, the American economy would be better off if Americans didn't feel the need to go to other countries for care, because you'd be keeping those dollars here. You'd be funding people's salaries here in the United States. Fortunately for us, Mexico and Canada are welcoming to people from other countries who come from countries that have third world health insurance systems, like we have in the United States, and we know how to fix it. Okay. We have plans for how it can be done. We know what it would cost, but we remain stuck in this decades long, I mean, it's really like a century long impasse, which dates back to the period between World War I and World War II, where we were starting to go in the direction of a more European model on healthcare. And then that idea was smeared as being too much like Germany at a time when we weren't getting along with Germany for good reasons, by the way. And it's been downhill ever since. And you know where we are today in 2019. But at least Canada is there for type 1 diabetes sufferers to go and get inexpensive and still reliable quality insulin.